Tento program vám přináší Milan Kroupa, majitel letiště v Edenvale.
Dobrý den. Dnes vám přinášíme pokračování programu z oblasti psychiatrie. Navštívili jsme Otavskou kliniku, aby nám Pavel Grof, jeho spolupracovníci a klienti mohli přiblížit výsledky 25letého výzkumu.
Dr. Groff and I have worked together for almost 2 decades now, and what we've been working towards is to integrate research that will advance our knowledge on how mood disorders develop in young people, what are some of the contributing risk factors, and how can we identify these problems earlier on and mitigate any poor outcomes and really keep the young people on a healthy emotional and physical trajectory. And so the way we've approached that is because depression and manic depressive illness run in families, we've been actually studying families. So it's a wonderful example of translating research into clinical practice and learning from our clinical practice in terms of what the next research questions should be. So we work with all the generations, so we see the grandparents, the aunts and uncles, the children, because really you can learn many different things from studying illnesses within families. An example would be, for example, breast cancer. That's how a number of different genetic variants were discovered, and also following people over time. That's the other component. So there's working with multiple generations within families, but there's also following family members over time, over development, and understanding what the evolution of these illnesses looks like early on, just like staging in breast cancer, and then to look at correlates both at the biological as well as the psychological and sociological level.
To je rodokmen jedný z těch mnoha velikých rodin, který sledujeme. Co se stalo před 30, před 40 lety, když jsme zavedli ty počáteční úspěšné stabilizační léčby, zvlášť litiem, a někteří ty pacienti, kteří byli velmi nemocní, byli hospitalizováni, dejme tomu, 20krát za posledních 20 let, a najednou na litiu byli úplně v pořádku po 10-12 let, tak začali nám vodit svoje děti a říkali, když tam takhle pomohli, tak snad byste mohli něco taky udělat s našima dětma. No a to byl začátek takového projektu, který teďka už běží po 25 let, a začali jsme sledovat rodiny jednak z zájmu o ten genetický příspěvek. Ukázalo se, že není tak velký, že je tam ještě řada dalších faktorů, ale nesmírně jsme se poučili o těch rodinách. Ta situace je v podstatě jiná, než si psychiatrie v těch posledních 100 letech představovala. Tam jsou takové představy, že ty nemoci mají velmi stejné příznaky a na základě toho se diagnostikují. V takovéhle rodině, když to člověk sleduje po několik desetiletí, tak se ukáže, že oni mají všichni podobný problém v tom směru, že typ toho onemocnění, průběhu toho onemocnění je stejný. Odpověď na léčby je stejná. Selhání léčeb je stejný u těch pacientů z té jedné rodiny. Ale přitom ta prezentace symptomová je velmi odlišná. Někteří mají jenom deprese, ten pacient, s kterým začneme, má tedy bipolární onemocnění, mania depresivitu. Ale ty příbuzní, někteří mají jenom deprese, někteří mají jenom úzkostné stavy, panické stavy, obsedantní stavy a tak dále. To je veliký překvapení a ukazuje se, že je opravdu nezbytný, když pacient přijde tak se dozvědět nejenom tu diagnózu, ale opravdu ty příznaky.
I first became ill when I was 19, and at that time I had a very severe bout of depression. I was very severely ill. I couldn't work. And I was quite suicidal quite often. I had lost a great deal of weight and I couldn't eat. I was so anxious. That episode lasted almost a year. And it took me a few years to recover from that. Like, I was able to work, but I had to work at something quieter, and I had to watch my stress level, and I just had to recover a bit from that. So that was my first experience. I didn't know what I was experiencing. I didn't know it was depression. At that time, I didn't have a doctor. I didn't go to a doctor. After that first bout of depression, I recovered from that, and then I was able to go to university and get a degree. After that, I started experiencing more bouts of depression, and they would last sometimes shorter, sometimes a few months, sometimes longer, but they were episodic episodes of depression. And I would say in a way that they became more severe. And I also developed anxiety in association with that. I was able to work, but it was very challenging.
Tento program vám přináší Technisonic z Mississaugy, výrobce vysílacích systémů pro letecký provoz.
I have bipolar 2 disorder, and I've been suffering from it, I guess, since I was a teenager. And I didn't recognize it for many years. I started out being treated for anxiety when I was a teenager for a little while. And I was depressed from time to time as I became an adult, and also had what I recognize now were more manic symptoms. In my case, there's quite a strong family history. My mother was ill. Her mother was also ill quite a bit, very depressed during her lifetime. And so I think that there's the family history, there's probably a genetic link. But also I think there have been difficult times in my life that perhaps caused more distress than I might have had otherwise. I was on my own at the age of 16 after my father died, and my mother and my brothers and sisters moved back to the Netherlands, where they were from. And I got married very young, had a difficult marriage, and so I had some difficult years until I was about 25 and things started to improve. I left my marriage and I went to university. So by that time I had a couple of kids. So I kind of did things the opposite way round to most people who go to school and then get married and have children.
Children of parents who themselves have had manic depressive illness or recurrent major depression, they tend to start off with about 30% may have non-specific problems in childhood, so anxiety and sleep disorders. And then after puberty, what happens is those children end up having a higher risk of developing major depressive episodes that recur, and then a proportion of those depressed adolescents end up manifesting activated or manic episodes. So in the what we call the high-risk kids at familial risk for bipolar disorder, you see this trajectory from non-specific to more specific, and from anxiety, sleep, to depression, to manic depressive illness. In the children that I mentioned, we also study for comparison who come from families where neither parent has had a recurrent major psychiatric illness or chronic psychiatric illness. Those kids, it's very interesting. They also can obviously have anxiety and sleep problems in childhood, not at the same early age and not to the same degree of frequency. But in adolescence, they start to have symptoms rather than major depressive episodes. They start to have anxiety and depressive symptoms in relation to identified stressors. So starting a new school, going to university, having their parents divorce. But the trajectory is different. They don't go on to develop recurrent major depression or manic depressive illness.
Těch rodin máme asi 120, ovšem ty velikosti se mění samozřejmě.
Jak tomu výzkumu pomáhají i ty, kteří nemají žádný onemocnění, ty bílé kostičky a kolečka?
No, to je na tom právě celý ten pokrok výzkumu visí, na tom porovnání toho, že to jsou všechno lidi, kteří mají potenciální predispozici pro to onemocnění. To je obrovská výhoda, protože doposud za těch posledních 40 let se opravdu našlo mnoho změn u bipolárních onemocnění, ale doposud stále nevíme, která jsou ta patogenetická, které ty změny hrají důležitý rozdíl v vytvoření té nemoci. Protože ten výzkum je skoro vždycky na pacientech, kteří už jsou nemocní, delší dobu byli léčeni a nedá se dost dobře odlišit, co je nemoc, co je průběh zhoršení, co je vliv léčby. Tohle je unikátní model, kde je možné od začátku ohodnotit ty, kteří jsou všichni v riziku, ale nemají žádné příznaky, a potom porovnat ty, kteří vyvinou tu nemoc a kteří ji nevyvinou.
I think it's very important to have research there to be able to understand more, constantly reading more so that you can better help patients. So I was very much interested because I think the idea, I love working with people, so working with the participants in a young group as well too, and then also the chance of also getting more information to be able to help patients as well. I think the ability to connect. I think having the experience of gone through certain years and certain experiences, I think you're able to be able to connect with them on a certain level. I think also too the idea of that, a lot of them, I think the life in them, they're still, they have a lot of motivation to change. If I'm helping with them with counseling or through any kind of struggles, there's this motivation to change. So, and a commitment to therapy, and so I feel like because of that, I really enjoy working with that age group.
I saw Dr. Groff, and the difference was that I had a very comprehensive assessment, much more comprehensive than I had had before. And what happened is that he was able to put together the symptoms I had at the time with my family history. So kind of how I felt was more reflected in how my whole family was, and my mother's bipolar disorder, and I have other members of my family who have depression or bipolar. And so he was able to see from all of that more specifically how I was affected. And he was able to identify that I could use another medication that would treat my anxiety. The illness has had a very far-reaching effect for me. I've made peace with it, but it in my profession, actually experiencing mood disorder actually allowed me to have more empathy for people, and actually was a help in my career, but it was also very challenging. There were times it was very difficult to work, and I struggled through symptoms, but I learned some coping skills. But so the illness affected my work, although I was able to work through it with difficulty. But also in terms of my family, unfortunately, it had a bad effect because we didn't know what we were dealing with, and my episodes of illness were very hard on my husband, and I really think actually it contributed to the end of our marriage. Now, now that I've been fully treated and I've had the treatment here, that's been a very big turning point for me. It's very difficult to kind of put words on how much it has helped. For one thing, I'm much calmer, and with every year I seem to get calmer and calmer, and it's changed my life completely. I can't emphasize how much it's helped. My mood is certainly better. My anxiety is pretty much, I think, a normal person's anxiety, although maybe a little bit more sensitive to stress. But it's, the way I describe it, like to my husband and to other people, is that I finally feel normal. I don't mean to be dramatic, but for the first time in my life, I feel what people think of as normal.
It took about 2 years. I was off work for about 2 years. And we tried different kinds of medication. But I guess what I learned here, especially, was that it took more than medication to deal with bipolar disorder. So I've learned that I need to take good care of myself, exercise and nutrition. Also, we've used cognitive therapy to help me deal with negative thinking, which is a big part of depression for me. And I've continued to use medication, so it's a whole lot of things that have to happen together to keep me feeling well.
Obecná psychiatrie pochopitelně funguje trošku jinak. Tam obvykle lékař vidí jedinýho pacienta po určitou dobu a ten rodinný důležitý kontext mu naprosto chybí. A my jsme, to nebyl plán, my jsme se do toho dostali náhodou, ty rodiče víceméně nás do toho přivedli, ale dneska je jasné, že to porovnání těch dětí, které vyvinou nemoc a nevyvinou, je unikátní možnost, jak zjistit, co vlastně tu nemoc působí. A teď je už asi 6-7 center po světě, které se teď snaží tohleto replikovat. Jako vždycky s novinkou byl ze začátku velký odpor. A především nám všichni říkali, že to není možné, že není možné sledovat především mladé lidi, že během 1 roku ztratíme 60% těch lidí ze sledování. Ukázalo se, že tím, když my poskytujeme také léčbu a sledování těm generacím, takže oni v tom zůstanou. My ztratíme tak 2-3% za rok ze sledování těch pacientů. Dnes v posledních 3 letech už se nám podařilo prorazit a byli jsme schopni publikovat prakticky ve všech velkých mezinárodních časopisech a ty práce jsou dnes akceptovány, ale to je teda skoro po 25 letech práce.
He's so involved in his work, so involved with his patients, so open to his patients and us. And also too, I just think he's so involved in other areas of his life too, that it's so easy to connect with him on a lot of levels, not just work. So I think because of that, I consider myself lucky to have someone to work underneath someone like that.
Life is not difficult. I don't have to struggle as much. I can sleep better. I can make decisions better. Everything is way better. I had a second marriage 5 years ago, and I don't think I would have been able to do that if I hadn't had the treatment I had here. And also I retired, and I know that I wouldn't be having the same retirement. I think that the work of the Mood Disorder Center, I think, is very, it's crucial, and it's something that I think that if this research and the treatment they're able to offer here would have been offered to me as a young person, my whole life would have been different.
I don't think we would all be doing so well if Dr. Groff's team didn't have this approach of working with the whole family and working on all kinds of aspects of your life. I retired a few years ago, probably earlier than I would have if I didn't have bipolar illness. But on the other hand, I'm working again part-time, after my retirement for a while. And it makes me happy to be able to do that sort of thing. And just to have good relationships with my family. I have 6 grandchildren, and I get a lot of pleasure out of being with them.
Doufám, že se vám oba programy o profesoru Groffovi líbily. A ráda bych podotkla, že tyto složité programy by nebylo možné vytvořit bez nového střihacího počítače, který jsme mohli koupit pouze díky vám. A tak bych ještě jednou chtěla poděkovat vám všem, kteří nás finančně podporujete a tím umožňujete zkvalitnit náš program. A já se s vámi těším na shledanou opět za týden.
Už po třetí vás zvou pořadatelé akce Eden Stock na letiště v Edenvale, kde 8. července odpoledne můžete spatřit, co jste ještě neviděli. Legendy rock'n'rollu a populární hudby, jako Beatles, Abu, Johnnyho Cashe, Elvise a Jerry Lee Lewise. Pochopitelně v podání jejich imitátorů. Koncert začíná v 1 hodinu odpoledne na letišti v Edenvale, Highway 26, blízko Steinera. Pro více informací volejte 705 428 3112 nebo zvolte e-mail office@edenflight.com.